Today I'm joined by Hannah. Hannah had a heart transplant in 2019. How are you, Hannah?
I'm good, thank you.
Going back to the beginning of your transplant story, you said that you in 2019 or before 2019, you hadn't had any health issues.
Nothing at all. I'd been completely well. No family history or anything. Just living my life.
Yeah. So what led you to needing to go to hospital?
So I'd spent about, I don't know, 5 weeks feeling really unwell, and I just thought it was a chest infection, and then I had symptoms of norovirus, so I ended up just kind of crashing at home. People would drop food at my door and run away. And I got to a point where I was just throwing up too much. I couldn't breathe properly. I couldn't sleep because every time I laid down, I was coughing. The GPs weren't doing anything. They just kept sending me away with more antibiotics. So I got fed up, and I just had to take myself to A&E.
Yeah. Was you living alone at that point?
Yeah, I was living alone. So I got to a point where I couldn't be by myself anymore, couldn't cope. So I just went to my mum's and stayed there for a week. And then after a week there, I just said, Mum, take me to hospital. Something's not right. We didn't know what. We just still thought it could be a bad infection. Mum thought I might have pneumonia. We had no idea. And then when we got there, they kind of looked pretty worried straight away. Rushed me to a side room, and then that was that. So I was in our local hospital, and they had me for about 4 days. The day after I woke up there, they said that I was in heart failure, but with medication, I might be able to, and like maybe a month's rest, I might be able to go back to a relatively like normal, whatever that is, life. So that was a shock, but we were like, okay. And then they started giving me some medication, and I crashed immediately. So I think after 4 or 5 days there, they sent me in an ambulance to a heart and lung hospital. And I was there. Yeah, so I was there. They sent me home in the middle for 2 weeks to try and get me to be okay on tablet therapy, but it didn't work. So I was pretty much in hospital the whole time, apart from 2 weeks, so about 4 months.
Yeah, and you're in your 20s, is that right?
Yeah, I'm 30 now, but yeah.
You were in your 20s at the time?
Yeah.
Yeah, so that must have been incredibly shocking for you and your family.
Yeah, I mean, I think we took it, and we just had to run with it because it was what was happening. But I think the whole time we were just in shock, yeah.
Yeah, definitely. And then, so you went through that and you crashed again, and then then there must have been talks of the transplant.
Yeah, so I mean, they mentioned it a couple of times in passing in the first couple of months, but it was always like that would be the last resort. We don't need to think about that yet. So, even for us then, it was like, well, we don't even need to worry about that. And then I think kind of after all the tests, everything that they did, they sent me home. They fitted me with an ICD, and it didn't work. And then that's when we knew. When I was at home for those 2 weeks, I had to come back up for clinic after a week, and everything just looked awful, all my blood work. And they said, go home for a few days, but come back in for a procedure. But be prepared that after that procedure next week, you might have to stay in for the long haul. And we knew then that it would be transplant.
Can you remember the time that they said we're going to put you on the list? And
yeah, so I think basically the day after I got readmitted, they said it's probable, but they had to have a few meetings and work it out. And then in the meantime, they had to get me to a dentist because I had to have my teeth checked before they could actually put me on the list. And so it took a couple of weeks or so. And then the day that they told me, my brother came up and my best friend came up, and we obviously knew. So it wasn't a shock. It was almost a relief, to be honest.
Yeah.
I don't want to be unwell anymore.
Tough. How was you feeling physically?
It was on and off. So I had an IV drip throughout, milrinone, which was a bit of a lifesaver. Actually was a lifesaver, but it made me feel well. So when I was on that, it was pretty good. But I did get sick quite a lot in between. So I had quite a few infections that I picked up, and I got sepsis and I got MRSA while I was there. So in those times I felt awful, and it was just that nausea, couldn't eat, couldn't really sleep, couldn't really do much. But when those times had passed, generally I felt all right, but it was the IV, the drugs.
But you knew that the heart transplant was the right thing, and it was something that you kind of knew that would help you get better.
Yeah, I mean, yeah, they because they said it sporadically. By this point, it was like we need some movement. We need to do something, because I was going downhill, I think, drastically.
Yeah, yeah. And then how long were you on the transplant list for?
It was 6 weeks in the end. They said to me, they gave me a bracket of 3 to 6 months because of my height and my weight and everything. They said around 3 to 6 months. So in my head, I thought, if I can stick it out for 6 months, 6 months is my my limit, and then see how we go. So it was much quicker in the end.
Yeah.
I had 2 failed calls. So I had one, and it couldn't go ahead. I think that would have been that was the DCD heart, and it didn't stop pumping in time or something. So they couldn't go ahead with that one. And then the second one which was actually the day before I actually had my transplant. So I had 2 calls within 2 days. So the day before one, the heart was too small for me. I was well enough to have my phone, and I did the odd Google, which wasn't really very wise.
Yeah.
And I did meet a few people through Instagram, I just needed to find people that were around my age that had gone through it or that were going through it, because, all the data and all of the patients, the lovely patients that I did meet in hospital, were all so much older than me. And when you're told transplant, you kind of think your life's over. That's it.
Yeah.
So I needed the evidence to see that there were people living and actually living. I think I haven't actually travelled since my transplant, because you can't travel, or I was told I couldn't travel for the first year.
Yeah.
And then COVID hit. So I'm desperate to get on a plane. But I think that first trip, I might be a little bit nervous, and, sorting out tablets and medication and making sure that I've got enough and that they're on me and everything. And then obviously insurance as well. There's all of that to look at, which I'm intrigued to see prices and stuff. But I can't wait to be on an aeroplane.
Yeah. What medication are you on?
I'm down to 11 tablets a day.
11.
My anti-rejection ones are tacrolimus and the MMF, and then mycophenolate.
Okay, I don't think many people I've spoken to are on that.
Oh, really?
Yeah, not that I can remember.
I don't know much about. I'm useless. I said that I had no illness pre-2018. So now, the medication and tablets, I'm very good at taking them and getting them organised. I have no idea really what they do. I just take them.
No, well, I've been taking tablets since I was 14, 15, and I'm exactly the same. The doctor said, these are the tablets you got to take, and I was like, fine with that. I just take them. And so how's the scar and everything healed for you?
It's okay. It's what's the word? It's me not knowing my medical words again. When it kind of bulges, or
Yeah, it just sort of gets thick almost. Yeah.
There's a word for it, and it begins with a K, and I can't remember what it's called. But it's gone a little bit like that in places, but it's fine. It's definitely there, and but it's healed well. It's all right. It's never really worried me too much. I think I kind of wear it proud, and it is what it is, and it is, like you said, it's kind of it's what got us here, really. And it's always nice to talk to people that are going through something that you have, or have gone through it before, and just to have a conversation about it, because no one else knows that situation better than transplant patients.
That's exactly it. We were both probably, I suppose, just getting over the fact that we've had that transplant, and then COVID come along. So how was that?
Horrible. It was horrible. It's I think when it first all started happening, it's difficult, because it was like that was supposed to be our year to kind of go and do the things that we haven't been able to do for however long. The first year after transplant, you have to obviously be more careful and more cautious. So,
and you're just recovering physically.
Yeah, and mentally, and everything else. But yeah, so it was a bit, it was crap. But you make the most of it, and you kind of, it's allowed me time to recover more, I think, and to understand and process it all more. But yeah, I miss going away and doing the things that we should have been doing.
Thank you very much for talking to me. It's been really interesting.
Oh, you're welcome. You're so welcome. It was nice to chat.
Thank you very much, Hannah. See you later.
Bye.
Bye-bye.